the disease with 1,000 faces. Difficult to diagnose, complex, and chronic. It will strike 1 in 900 Canadians. Lupus. This autoimmune disease alters patients' lives, and if left untreated, can be fatal. At the BC Lupus Society, we provide support to people living with lupus. Because lupus is unpredictable, we strive to be dependable. Our programs include weekly support groups for patients and families in British Columbia. We make sure that educational resources and peer contacts are always available, including for patients facing a new lupus diagnosis. And every year, we help fund clinical training and medical research that benefit people with lupus. Through the BC Lupus Research Scholar Program, our goal is to advance treatments and discoveries to change the future of lupus. Our partnership with university researchers is unique in Canada and has helped understand the full impact of lupus and the effectiveness of lupus care. As part of our community, you're a valued part of annual events like our Lupus Gala and the Shed Light on Lupus Walk. These fundraising activities generate just part of the funds needed to sustain our work in patient support and medical research. With the generous support of donors like you, the BC Lupus Society will continue to be here for patients and families affected by lupus. Not only can we change tomorrow, we can brighten today. Thank you from the BC Lupus Society.
Hello, everyone. My name is Vera. I'm an associate professor at UBC and a research scientist at Arthritis Research Canada. It's an honor for me to be part of this year's BC Lupus Society Symposium and present lupus and mental health. I will be sharing with you fresh, hot out of the oven research from Arthritis Research Canada. You are going to be the first to be hearing these results. I am coming to you from my office here at UBC, so I would like to take pause and acknowledge that UBC is situated on traditional, ancestral, and unceded territories of the Musqueam Nation. And knowing that you are all joining the symposium from many different lands, I also invite you to take pause to recognize those lands and the stewards of those lands. I think I share this with all my presentations. I'm proud to be a longtime friend of the BC Lupus Society. I love sharing oldie but goodie photos from previous events, like the BC Lupus Gala in 2015, where the baby in the belly is the little girl holding the orange balloon in the BC Lupus Walk in 2018. And here are just talks that I've been able to share also virtually through prior BC Lupus symposiums. So in lupus, instead of defending the body, the immune system attacks it, including the brain and the nervous system. That's why mental health is an important consideration in lupus. So from prior research in this area, we know that at the time of a lupus diagnosis, up to 24% of patients will already have comorbid depression, and up to 37% will have comorbid anxiety. We also know from prior research that after someone is diagnosed with lupus, a patient has a twofold risk of being diagnosed with depression or anxiety compared to someone who doesn't have lupus. That's a very significant risk. Knowing all this, what we actually need to know is how is mental health treated in patients with lupus? According to the World Health Organization, mental health conditions in general are undertreated and under-resourced. So I wanted to know, is this the same picture for lupus, particularly in BC? So BC is actually one of the best places to do population-based research in lupus because we are a very data-rich province. So in BC, we have the ability to gather de-identified and completely confidential individual-level data on healthcare encounters, such as doctor visits and drug prescriptions, And this is a data platform that is available for researchers like myself, and this is known as Population Data BC. So using the Population Data BC data platform, I identified patients with lupus with mental health conditions, and I will be sharing results of our analysis for those with depression. So we found that 63% of those patients, again, they have lupus and they also have depression, 63% receive antidepressant treatment. And these were often most commonly prescribed by the family physician, so 84%, but also by psychiatrists and the rheumatologists. We then applied this metric called minimally adequate treatment. So specifically, we wanted to see if patients had at least 84 days of medication on hand. So this number is actually based on prior research that's shown that that's the number that one needs to have during an acute period in order to have clinical improvement. So when we use this metric, again, do patients have at least 84 days of antidepressant medications on hand that they can take? We found that only 50% of patients met minimally adequate antidepressant treatment. We also looked at counseling and psychotherapy. So when we looked at these, the threshold was at least 4 sessions, either in an individual or a group setting. And we found that only 22% of patients had minimally adequate counseling or psychotherapy treatment. But I do have to point out an important caveat that with our data, we were only able to look at those that were taking place within the public healthcare system. So we did not have the ability to look at private sessions and those that were paid for by a private insurance or out of pocket by the patient. So then I wanted to ask, okay, we know the picture for lupus. What about the picture for those without lupus, but also had depression? So I identified what we call in research controls. So these are individuals without lupus that we actually match to individuals with lupus on age and sex. For example, if I had a lupus patient who was a 40-year-old female, then I had a control, that's someone who does not have lupus, but who was also female and who was also 40 years old. So using those same metrics, we actually found some similarities. So among controls, about 50% also had minimally adequate antidepressant treatment. And the picture is similar when we talk about counseling and psychotherapy treatment. So about 23.6% for controls. So what are we learning from this research and what is the take-home message from today? So patients with lupus with depression are similarly treated as controls, but there is an undertreatment of mental health conditions, specifically for patients with lupus who had depression. So again, only about 50% of those patients received minimally adequate antidepressant treatment, and only 22% received minimally adequate counseling or psychotherapy treatment. So I think knowing all this, there's definitely a role of awareness and advocacy, and that's why it was really tremendous for me to have the opportunity to present these findings through this symposium, because we're hoping, I'm hoping that, with this understanding and knowledge, there is going to be awareness, advocacy, and action to improve mental health treatment for patients with lupus. And with that, I want to thank everybody again for joining us in the symposium, and thank the BC Lupus Society for the invitation and the opportunity to present my research. Thank you.